So welcome to this presentation on the nervous system. My name's Dr. Oscar Serrallach, and we're going to spend about 30 minutes or so just talking about essentially what is the nervous system, why do we have a nervous system, and what are the components of the nervous system, and then a little bit about how we assess the nervous system and some of the principles involved with caring for the nervous system. Why do we have a nervous system? The nervous system is that part of us which is very adaptable to the environment. So in terms of adaptation, if things are too hot or too cold, just as an example, it's our nervous system that allows us to regulate these things. And I think this is quite nicely shown in Maslow's hierarchy of needs. We have biological needs, but we also have social needs and emotional needs and spiritual needs. And our nervous system allows us to adapt to all the challenges out there. It's trying to get us back into a middle point or a Goldilocks zone, if you like. And just a little bit of brief overview of the nervous system. The nervous system contains two major branches. One is the brain and the spinal cord, called the central nervous system. And then we've got all the nervous system that comes off that, which is the peripheral nervous system that sort of lives more in the body. Now, this peripheral nervous system has sensing parts to it, and then it has action parts to it called the motor neurons. Many of those motor neurons are under our control, and these are to do with more the muscles, hence somatic nervous system. And then there's a whole lot of stuff that's under automatic control or the autonomic nervous system. So these are things that we don't have to think much about, thank goodness. And the two main branches of this is the activation, which is sympathetic, and then there's deactivation, parasympathetic. So it's like an accelerator or a brake. And if we have a look at where this autonomic nervous system lives, on the left-hand side, you can see the sympathetic nervous system. These are all the things that are getting us ready for action. So in terms of pupil constriction, speeding up the heartbeat, many things help us get ready for action, and that's all the sympathetic nervous system that does it. And that lives, as you can see here, in the red dots on the left, and that's mainly in the spine. Now, the parasympathetic, again, is the brake, and that's very much involved with deactivation. Okay, we've had our time of busyness and stress, and now we have the opposite of relaxation or deactivation. And so, and this mainly is the vagus, which comes out from the cranial nerves from the skull, and then there's a little bit that also comes out of the very base of the spine. You can see here in the blue on the left-hand side. One analogy that I quite like is that of the aeroplanes. If you imagine our bodies like an aeroplane, and the nerves are very much like the wires and the sensing apparatus in the plane. If you can just sort of follow that analogy, then the cockpit is very much like the brain. It's sensing all this information and then reacting to it. And it's assessing, and then it's reacting. And all this action is going on in the cockpit. And you can imagine these pilots are a little bit like consciousness, if you like, or our personality, trying to kind of navigate things with the information that's coming in, and then hopefully making the correct decisions in terms of the information going out. Now, there's way more information coming into the brain than there is leaving the brain, but all the processing and decision-making is essentially done here in the cockpit. So one psychiatrist from the United States who's very involved with really looking at new psychiatry, if you like, is Dr. Daniel Amen. And he's got a great saying that your brain is always listening. So it's this cockpit with all the lights, it's always sensing what's going on. And he's very much about the environment that you have around you very much dictates how your nervous system is going to therefore be operating. And we're very adaptable, and that's and that can be a gift and a curse in terms of our environment. And we shouldn't be called Homo sapiens, I don't think. I think we should be called something like Homo adaptus. You know, we're very good at adapting to hot climates, cold climates. We can go without food for a while. We can and really modify our environment to our needs. But it also means that there is potentially a Goldilocks zone where our nervous system does better. You know, we're really designed for stress on, stress off. We're not designed for stress on, stress on, stress on. And the modern lifestyle can look very much like that in terms of just we're activated the whole time, stress on, and we don't have enough deactivation or stress off to sort of balance things. And so we're outside our sweet spot Goldilocks zone, and we're spending much more time in sort of constant sort of stress. And we'll talk about that in a moment. So humans are unique in terms of how much energy we spend in terms of brain power. We spend about 20 to 25% of our energy budget, if you like, on the brain. The next animal in the animal kingdom clocks in at around 9%. So there's a huge discrepancy there. And so, and what the bulk of that brain processing is related to filtering and predicting. So there's so many data points coming into the brain that the brain has to actually filter out a lot of what is essentially just noise or not necessary. Researchers thinking about we have about 11 million data points per second coming into that cockpit, and the brain has to filter that out to about 4,000 usable data points. So it's, and those data points are around the things that are changing or that we suspect might be changing. Now, once you've put your socks and shoes on, you don't want all this information about each toe coming to your brain, and so we're quite good at kind of filtering those kind of things out. And it only comes to our attention if something feels different in our foot, for example. And interestingly, of those 4,000 data points that the brain's kind of juggling, only 40 of those are actually in our conscious processing. So there's a great kind of filtering system. It's very efficient, but it requires a lot of energy. And what's interesting about the brain workload is most of it is just about recalibrating to what's just happened and trying to predict what's about to happen. So the brain spends most of its time in the very near future, what's about to happen. And then it only really alerts us if things aren't quite what we were expecting. It's always looking for change, but it only comes into our consciousness when there is a change we weren't expecting. An example that I use is around door handles. And the average person might touch a door handle between 5 to 40 times per day, and we have no recollection of the door handles that we touched in the day. And we would only remember the door handle if there was something unusual about it. It was very hot, it was very cold, it was very soft, it was spiky. But if it was just a stock standard door handle, we don't even register it. It's all there, but in terms of us opening that door, it's that autopilot living in the in those 5 to 10 seconds from the here and now that are kind of predicting things. And so again, the brain is waiting for change, but doesn't necessarily like change. Change can be quite stressful if there's too much change going on. A little bit of humor now. So a cartoon showing that it is a two-way street, and sometimes the problems can actually be in the cockpit. And here, the Gary Larson cartoon, and one pilot is saying to the other pilot, "The fuel light's on, Frank. We're all going to die." Wait. Oh, my mistake. That's the intercom light. And this is quite a cute joke in terms of just how the brain is always on, and the body is there waiting for signals from the brain, and then the body's sending signals back to the brain. So this is a pretty unhappy plane right at this moment. A few more things about the nervous system. The nervous system is essentially the top of the hierarchy. The reason why I say that is the nervous system dictates signals to the hormonal system. So here you can see the picture of the brain, and it's sending signals from the hypothalamus to the pituitary, still within the brain, and then the pituitary sends signals to the different glands of the body. And in this case, ACTH here is being secreted to signal to the adrenal glands to do activity. And so the metronome setting the pace is the nervous system, and the hormonal system is just responding to instructions. It's the same with metabolism, and it's the same with the immune system. You can see here the immune system is receiving signals to both the bone marrow and to lymph nodes, and then responding. And it's how our hormones, metabolism, and immune system work really dictates our sense of well-being. Do we have energy? Do we feel motivated? What are our moods like? And a lot of this is just a downstream effect of how all this is working. An important concept to now sort of talk about is Polyvagal System. And to break it down, to make this quite simple, essentially we have in the middle of this ladder the red accelerator, which is called sympathetic. We talked about that previously. And then top and bottom we have two brakes for the nervous system to essentially dampen down emotion. So the sympathetic is about activation of the body. It increases our emotional state. The green box here, which is the ventral vagal, is parasympathetic, and it's the brake that helps tone down some of the negative emotions to allow those positive emotions to come up. And then the blue brake, if you like, the dorsal vagal parasympathetic, also is about switching off all emotions. So it's about shut down, and we can feel disconnected in that state sometimes. So again, just imagine your car, one accelerator, two brakes. Now there are variations within that of accelerator up and down and brakes up and down that we're going to talk about, and these are called blended states. The first blended state to talk about is called play or flow in adults. And that's often when we are absorbed by an activity and we lose a sense of time and we're engrossed. So play, flow, that's what that state's about. And you can see here that the accelerator's on, sympathetic, so we're getting activated, but also the safe and social ventral is activated. So, and then the dorsal is not activated. And we all know when kids are playing, if it becomes too rough, for example, when they're playing a rough and tumble game, but the rough and tumble becomes too much, sympathetic gets too activated and it's not play anymore. They get pulled out of this blended state. The next blended state to talk about is stillness. Safe and social with shutdown. Sympathetic, the accelerator is really toned down, and both ventral vagal, dorsal vagal. So what we're trying to do is enhance those good emotions, but really calm down emotions overall. And I like this definition. Stillness is the ability to be able to be still without fear. And this is a very essential blended state for things like sleeping, for meditation, for intimacy, and for some of these relaxation therapies like yoga. And the third blended state worth talking about is freeze, where you have the sympathetic fight or flight activated, you have the shutting downs of emotions activated, which is the dorsal vagal, and then the safe and social ventral vagal is really deactivated. And this is deer in the headlights. Often people in a traumatic state, overwhelmed, can get into this freeze state, but this isn't essentially bad. It's part of our survival, and it's probably got us through some very challenging times of being lost, being predated upon, maybe being injured, and we go into this freeze state, and we might survive the stressor. But this isn't intended to be activated very often in our lives, and certainly not frequently. So moving from this idea of the blended states, we're actually going to have a look at the nervous system in action now. So here is a graph showing a healthy nervous system, and this is an acute stress reaction, and in someone who's got a healthy nervous system. So this is a timeline on the bottom here, and at baseline you can see that the blue, parasympathetic, the tone of that is above red, which is sympathetic. So we're waking up, we're in a relaxed state, and then we experience our mild stressor here. So say someone drops a glass and it smashes on the floor, we react to the sound, we have a sympathetic stress reaction here. You know, we might feel our heart racing and getting that kind of surprise, and then we are able to deal with the danger, clean up the broken glass, and then we get a parasympathetic rebound. Oh, okay, we dealt with that, that's great, and then we kind of return to baseline. That's a healthy nervous system in action there. The next slide is going to be an unhealthy nervous system that is having chronic stress. So again, we wake up, blue is above red, so we're in a relaxed state, and then we have our stressor. The broken glass smashes, and we get a very strong sympathetic response, and much more than is necessary or required for the situation. And you can see here that not only does the sympathetic response go much higher, it stays around for a lot longer. We don't get the parasympathetic rebound, and then there's a failure to recover. And this is the important part. This person has been left in a stressed state after the stressful event, and the body hasn't been able to recalibrate. And this can sometimes be not just for minutes, but for hours after the event. And just for completeness' sake, we'll have a look at a traumatic stress response, and this actually has to do not with the broken glass, but a trigger that is involved with that person's original trauma. So again, we wake up in a relaxed state, blue is above red, and this person is exposed to their traumatic stressor. So it may be that they're walking down the road, they've had an accident many years ago where they were hit by a blue BMW, and they suddenly see a blue BMW. They get triggered. They're safe, but they get triggered into a trauma response, and you can see what happens here is essentially what looks like a cat chasing its tail. You get this extreme sympathetic response followed by an extreme parasympathetic response, and it just goes up and down like a yo-yo. And if you've ever seen anyone triggered by a traumatic stressor, you can understand that they are very challenged to negotiate the world when this is going on. Their sense of recall, their decision making, their mood, everything is going to be highly, highly affected by this. Let's move on now to something called co-regulation. So, okay, we've talked about our nervous system. What's interesting is that the recent research is showing that our nervous system, like a metronome, can sync up with other people's and other animals' nervous systems. And this can be a good thing, and this can be a bad thing. And we all know this feeling that when we're around certain people, we feel good. Other people we feel quite funny. Other people can make us feel timid or nervous. In this case here, we have a dog with his boy. The dog's on the top graph here. The boy Josh is on the bottom graph. Josh walks into the room where the dog is, and they start to play, and the boy's stroking the dog, and you can see that there is actually a syncing of their heart rate variability, and we'll get back into what that means exactly, but you can just see visually there is a form of healthy co-regulation here. And then once the boy leaves the room, they go back to their kind of more solo nervous system state. Here's another beautiful example with a mother and her newborn child. So in this particular case, the mother isn't actually touching the child. She's simply looking at the child. and she's in the baby bubble, and you can see here that the baby's heart rhythm on the bottom here in red, and the mother's brainwave activity can sync. So they're literally like diving dolphins or two metronomes. They can be in sync, and so again, this is an example of the co-regulation. And we all know that a nervous mother can make the baby nervous, and a nervous baby can create nervousness in the mother. And this is just one of the mechanisms at play. So we've talked a lot about the mechanics of the nervous system. Now we're going to spend a little time talking about nervous system practices and then some nervous system therapies. So these are my definitions. So a nervous system practice is something that you typically do yourself, maybe at home, and they're often not, they can be quite short things, and they're things that we just do regularly. And you could almost imagine it's like incidental exercise for the body, and then the nervous system therapies are things we typically do that are longer, we do with someone else or in a class, and that's a bit more like gymnasium for the body. And the nervous system needs both practices and then the sort of therapies to really stay in a healthy state, to be able to stay in that recalibrated state where the 0 point is actually at 0 and not in stress, and so we can react appropriately to the demands of the environment. Now, with nervous system practices, there are two main conditions. The first condition is that there needs to be a sense of stillness. Now, you don't have to physically be still. You can be walking in nature, but feeling a sense of stillness. And then breath awareness. So being aware of your breath, because this is one of the ways that we can tap in to that autonomic nervous system, is by being aware of our breath and then trying to control our breath. What's interesting is that researchers don't call it breath awareness. They often describe it as paced respiration. And what that means is that you slow down your breathing and you have a slow, even in-breath, where every second of the in-breath is a similar amount of air coming into the lungs. And then you have a slow, even out-breath, where again, every second the amount of air leaving the lungs should be the same. You're not blowing out all the air in the first couple of seconds and then holding your breath for the rest. It has to be an even out-breath. And some research shows that the out-breath being slightly longer may be beneficial. One that's typically talked about is a breath count of 4 in, 7 out, where we're just kind of breathing in, 2, 3, 4, out, 2, 3, 4, 5, 6, 7, in, 2, 3, 4. And the pace would be something a little bit like that. Now, the list of what would constitute a nervous system practice would be very, very long. I've just put a few in here, and I'm sure you can fill out many things that you do that you think, oh, that feels like I've got some stillness and I'm aware of my breath, and that I can tick the box for that. A gratitude practice, meditation, a walking meditation, we mentioned that. Things like Tai Chi and yoga where there's movement, but there's often encouragement to really do the movement with your breath. We know that being in nature is quite a potent trigger for, a positive trigger for the nervous system. Being creative can be also very useful, and that can actually create that flow state or play state that we talked about before. Singing, chanting, especially in groups, and then things like stroking your pet, like in the previous example with the boy and his dog. And essentially this is part of the reason why we have pets. It's not that they necessarily do much for us, but they're actually really good for our nervous systems most of the time. So I often feel that the nervous system practices are like coins into a piggy bank. Just one coin isn't going to make much of a difference. Lots of coins will make a big difference. And so how do we remember to, I should do a 30-second practice of just some breath awareness? And so I call those cue points. A cue point is something that will trigger you, remind you to just do a little exercise. It's an invitation to relaxation. And with many of the busy mothers that I C, I really just try to be very specific. Going, well, maybe when you're physically still, that can be a cue point, being on the toilet, traffic lights, physically being in the queue at the supermarket, and you can just do a round of 5 breaths in, 5 breaths out with that count. And you can have all hell breaking loose around you and still use that as a nervous system practice. Something else that I talk to about with clients is a dental health practice versus a mental health practice. Now, we usually brush our teeth twice a day and we don't think too much about it. If someone's interrupting us brushing our teeth, we don't throw our toothbrush in the air and go, oh, I've just had my teeth clean ruined, you know, I can't concentrate. No, we don't do that. We just get on with it, but we just make sure we do a relatively good job. We do it regularly, and it comes to a point where it's so much part of the routine that it feels odd if we don't brush our teeth. Ideally, we're doing things that are maybe similar, but from a mental health practice point of view, that we're doing regularly, that if we're getting interrupted, no big deal. Let's just continue, and it eventually gets to the place where it may feel odd if you're not doing it. Oh, I haven't done my 5-minute sort of breath exercise in the morning. It really sets my day up well, and I notice that I haven't done it this morning. That's really what we're aiming for. And then nervous system therapies, again, these tend to be bigger things that are that may be an hour and a half. May involve a teacher or an online portal. May just be that we're doing a guided meditation, something like this, but it's and this is the gymnasium for the nervous system, these nervous system therapies, because we're often getting into those good blended states, and that can be therapeutic. Just a few examples. Again, the list would be very, very long here. Getting a massage done, getting some beauty therapy done. Somatic experiencing is a specific type of therapy that people can do. Again, we've talked about yoga and Tai Chi. Equine therapy, where essentially your nervous system is syncing up with the horse's nervous system, and you're trying to get the horse to trust you, so it'll go through a course and do things that it doesn't necessarily want to do, but just as an example, tapping, havening are becoming quite popular, and we're seeing much more use of saunas, cold therapies, certain types of exercise, and the list goes on and on. And I'm sure they're all things that we can think of going, yeah, that is kind of, I could put that under there. And then I'm just going to spend the last part of this talk talking about a specific type of therapy called heart math. And this is by no means the best or the greatest therapy out there, but this has been around for a very long time. And I think conceptually it's very useful to have a look at this, because it talks about a lot of the things that we've done, and it's a type of biofeedback looking at heart rhythm and heart rate variability. And then you can see various devices here. We're going to finish off with a heart math presentation using an EMWave Pro from the bottom here. But the inner balance is something that you plug into your phone, and you just are guided through some breathing exercises to get into a state of coherence. We'll talk about that in a moment. And with the EMWave Pro, when we look at that, you'll notice that there are different exercises you can do. There are even games that you can play, and the less stressed you are, you can kind of advance in the game. So it's a type of gamification, if you like. So the heart math is basically looking at heart rate variability. So this next slide shows heart rate variability, and we don't have exactly the same heartbeat ongoing. There is variability as we breathe in and as we breathe out, and as we're changing our body position. But when we're in a relaxed state, what happens is that you can see there's almost a nice smooth up and down of the heart rate variability. How much space is there between each heartbeat? And there should be nice and smooth, even concertinaing of the heartbeat as we're going through. And this next graph sort of highlights that. So on the top here in red, we have someone who's frustrated, anxious, worried, and irritated. And you can see their heart rate is going up and down a lot, but not in a coherent fashion. It's all over the place. It's a scribble. And this is the same person later on after they've done some heart math, and they're now in a state of coherence where you can see the heart rate variability just going up and down smoothly, and this person is in a much more relaxed state and better able to deal with the challenges of the external world. And so we're just going to finish this off now with a heart math presentation, and hopefully this really highlights a lot of the things that we've sort of talked about. And looking after your nervous system is paramount. We should learn about this stuff at school. We don't, so typically as adults we're learning about how to regulate and manage our nervous systems. So I hope you found that useful. Thank you for tuning in today, and we'll see you at the heart math presentation.